So you just had your pre-op visit, and I'm sure your head is probably swimming with a ton of information right now. That's totally normal. That's exactly why we made this guide, to walk you through everything, step by step. Our goal here is simple, to make your journey to surgery and recovery feel clear, calm, and as stress-free as possible. Let's dive in.
Here's a quick peek at our roadmap. We'll start with what you need to do right now, then we'll get into your pre-surgery checklist, what to expect on the actual day of surgery, how to handle recovery, and finally, we'll wrap up with some really important rules and resources. So let's get started with your first steps.
First up, your journey really does begin today. Let's talk about what you need to do right after your visit to get your surgery officially on the books.
You were just given a whole lot of details, and it's easy to feel overwhelmed. So our goal here is to just boil it all down and go over the most important takeaways. No fluff, just what you need to know.
Okay, you've got 3 simple things to tackle first. Step 1, get that medical clearance order over to your primary care doctor. Step 2, swing by the pharmacy and pick up your antibiotic and, if it was prescribed for you, your Valium. And step 3 is the easy part. Just wait for our call. As soon as we get that medical clearance back, we'll give you a ring to schedule your surgery. Of course, you're always welcome to call us if you know it's been sent over.
All right, let's move on to your pre-surgery checklist. Think of this as your simple to-do list to make sure you have everything ready for the big day.
Here are a few things for your shopping list. First, you'll need a post-operative shoe, something like a Darko Duo, which will protect your foot while you heal. A waterproof cast cover is an absolute must-have for showering. You'll also need 2 different widths of 3M Durapore medical tape, but don't worry, you can grab this after your surgery. And hey, just a reminder, if you don't want to hunt down the shoe, just let us know. Our office can provide one for you.
Okay, let's talk about your medication countdown. And this is extremely important, so please pay close attention. 3 days before your surgery, you need to stop taking any blood thinners, but make sure you're following the specific directions from your cardiologist on this. Then, 1 day before, you'll stop all NSAIDs. That's stuff like Advil, Aleve, and aspirin, because they can increase bleeding. Finally, on the morning of your surgery, you'll take your prescribed antibiotic. Sticking to this timeline is absolutely crucial for your safety.
And just like that, the day of surgery will be here. Let's walk through your morning plan and what to expect so everything goes off without a hitch. Here is your game plan for the morning of the surgery. Start by washing your feet with antibacterial soap, but please, no lotion. Then, get dressed in clean socks and some comfy, loose-fitting clothes. Good news, if you're only having local anesthesia, you can go ahead and eat a normal meal. Now this next one is non-negotiable. You absolutely must have a ride arranged to take you home. And lastly, if you were given Valium, take 1 tablet about 30 minutes before you get here, and then bring the rest of the bottle with you.
Now for a really vital safety rule about driving. It is completely unsafe to drive a car while wearing a surgical shoe on either foot. It can get caught on the pedals or just prevent you from braking properly. The rule is simple and you have to follow it. Always take the shoe off before you start driving and only put it back on once you safely parked and arrived at your destination.
Congratulations! You did it! The procedure is complete. So now let's shift gears and talk about navigating your recovery. We'll cover all the first steps you need for a smooth and speedy healing process.
Your care at home really just boils down to some simple do's and don'ts. On the do list, elevate your foot above your hip as much as you possibly can. I can't stress this enough. It's the single best way to reduce pain and swelling. Do use a cold compress. A bag of frozen peas wrapped in a towel is perfect. And do keep every single one of your weekly follow-up appointments. Now for the don'ts. Under no circumstances should you get your dressing wet. Don't put ice packs directly on your skin. And please, please do not open or try to remove the dressing yourself. We will take care of all of that for you.
Believe it or not, what you eat can actually make a difference in your recovery. To help keep swelling and inflammation down, we recommend a few little tweaks to your diet. Try to cut back on salt, since that can make you retain fluid. And for now, it's best to steer clear of shellfish and fried foods. It's a small change, but it can make a really noticeable difference in how you feel.
Now for a very important question, one you need to know the answer to: when should you call for help?
Okay, I need you to listen closely to these 2 signs. These are the red flags. You need to get medical help right away if you develop a fever of 101 degrees Fahrenheit or higher, or if you have heavy, non-stop bleeding from your incision. If either of these things happens, call our office immediately. If you can't reach us, go to the nearest emergency room.
We are on the home stretch now.
This last section is all about important rules and resources. We'll cover a few key policies and make sure you know how to get in touch with us.
I want to be crystal clear about this next point, because it's non-negotiable for a successful recovery. Weekly follow-up visits are required. These appointments are absolutely essential for us to do skin checks and re-strap your dressing, making sure everything is healing exactly as it should. Please make it a top priority to be at every single one of your scheduled visits.
Next, I just want to briefly touch on our cancellation policy.
So a $500 fee applies if a surgery is canceled within 3 days of the scheduled date. Now, this isn't meant to be a penalty. It's simply to cover the costs for the team and the resources that we've reserved specifically for you on that day. Of course, we know that true emergencies happen, and we can absolutely make exceptions for documented situations.
And finally, please remember that you have a whole support system here. If you have any questions or concerns at all, call our clinic at the number on your screen. You can also log into your patient portal anytime to look at your signed consent forms. And one last key reminder, please do not schedule any travel for at least the first week after your surgery. Your foot needs time to rest.
And there you have it. You are now equipped with a clear, step-by-step plan for a successful surgery and a smooth recovery. We've covered everything from your first few tasks to that first week post-op. So we'll leave you with one final thought to get you started. What's the one thing you'll do today to begin preparing for your journey?